Hi, my name is Rachel Bryan. I'm an Auburn nurse practitioner student, and I'm here to do my head-to-toe video on my patient here, Hunter. Before the exam, I got his vital signs, which were all normal, his height and weight, and I tested his visual acuity with the Snellen chart, and it was 20/20. All right, so we're going to begin the exam. I'm going to inspect his head first. I don't see any deformities, no masses. His scalp looks good. His hair is well distributed. His neck looks normal as well. No masses or deformities there. No lesions either. I'm now going to palpate. Let me know if you feel any tenderness.
Nope.
No tenderness. Next, I'm going to check his sinuses. First, the frontal sinus. Any tenderness?
No.
No tenderness. And his maxillary. Any tenderness?
Nope.
Perfect. Next, I'm going to assess his lymph nodes, starting with the parotid right here, the preauricular, the postauricular, occipital, tonsillar, submandibular, submental, and then the anterior cervical, posterior cervical, and supraclavicular. Good. Any tenderness with those?
None.
All right, and none of them were palpable. Next, I am going to test for lateralization using the Weber test. So I'm going to hit this and put it on the top of your head. You let me know if you can feel it in both ears or just one ear.
Both ears.
Both ears, perfect. Next, I'm going to check for air and bone conduction, which first I'm going to do the same thing by hitting this. I'm going to put it on the back of behind your ear, and when you stop hearing it, let me know. I'm going to put it at the front and let me know when you stop hearing it that time too.
Can't hear it. Can't hear it.
All right, good. So the air conduction is greater than his bone conduction on that side, which is normal. Do the same thing.
Can't hear it. Can't hear it.
All right, and same with that side, air conduction is greater than bone conduction. So that is normal as well, and that was the Rhines test. Next, I'm going to take a look at your eyes using my pen light here. His eyes, the sclera is white, conjunctiva pink. His eyebrows are well distributed. So just look straight forward. I'm going to shine this light in your eye. Good. Good. His pupils are equal and reactive to light. Next, I'm going to take a look in your mouth. Look at the top of his mouth. His tongue looks good. All teeth are there and intact. And put your tongue up. That looks good as well. And pull your bottom lip down. And the mucosa looks pink and moist there as well. And next, I'm going to take a look in your eye, to take a look at the back of your eye for your optic disc. Let me switch those settings. There we go. Okay. And just keep looking straight forward. All right, good. This optic disc is round and a yellowish orange color. Same on this side. Perfect. Same as that side. His optic disc is round and yellowish orange color. Next, I'm going to take a look in his ears. And on inspection, his auricle looks good. There's no lesions or masses. I'm going to just feel any tenderness.
No.
No tenderness. I'm going to take a look inside. Good. There's no erythema, no exudate, and his tympanic membrane is pearly gray. Same thing on this side. His auricle looks good. No lesions or deformities noted. Any tenderness?
None.
Good. And same with that side. There's no erythema, exudate, and his tympanic membrane is pearly gray. Next, we're going to take a look in your nose. And first, I'm going to check the patency of your nose. So hold one nostril and inhale in. Good. And same with the other side. Good. So his nose is bilaterally patent. Going to take a look here. And just tilt your head up a little bit for me. So on both sides, his nostrils are pink and moist, turbinates patent, no polyps noted, and his septum is midline, no deviation noted. Let's see. Next, I'm going to test or check your temporomandibular joint. So I'm going to put my hands right here and just open and back in. Good. No popping or clicking noted. Any tenderness?
None.
No tenderness. Good. So next we're going to start checking your cranial nerves. First I'm going to have you close your eyes. And I'm going to put this object underneath your nose. You're going to smell it and tell me what you smell.
Alcohol.
Perfect. So his cranial nerve 1 is intact, which is his olfactory nerve. And you can go ahead and keep your eyes closed. And you're just going to tell me what side you feel me running across, okay?
Soft.
What side do you feel it?
Oh, right side. Left side.
Perfect. And so we'll test for pain sensation. Do you keep your eyes closed?
Soft. Soft. Pointy. Pointy.
All right, perfect. So his cranial nerve 5 is intact. And next I'm going to check your visual fields. So I'm going to stand in front of you, just look directly at me and cover whichever eye you want to do first. So I'm going to cover my left and tell me when you see my hand coming into view.
See it.
Perfect.
See it. See it. See it.
All right, we're going to do the same on the other side.
See it. See it. See it. See it.
Perfect. Now you're just going to look straight at me and you're going to follow my finger without moving your head. Follow my finger. Perfect. So his visual fields are intact and his extraocular movements are also intact, meaning that his cranial nerve 2 and cranial nerves 4 and 6 are intact. Alrighty, so next we are going to check for his cranial nerve 8, his auditory nerve. So I'm going to whisper something behind each ear and you just repeat what I'm saying.
War. Eagle.
Perfect. So his cranial nerve 8 is intact. Next I'm going to check cranial nerve 7. So just follow what I say. Raise your eyebrows for me. Smile. Frown. Puff out your cheeks. Good. So his cranial nerve 7 is intact. Next we are going to check for cranial nerve 9 and 10. So go ahead and open your mouth for me. Say ah.
Ah.
So his uvula moves midline, which means his cranial nerve 9 is intact. And I'm going to check your gag reflex. So open up.
Ah.
So his gag reflex is intact, and that's cranial nerve 10. Next, we're going to check cranial nerve 11. So push against my hand. Other side. Cranial nerve 11 is intact. And the last cranial nerve 12. Stick out your tongue for me. Move it side to side, up and down. So his cranial nerve 12 is intact. Next, I'm going to have you repeat what I say to check for cranial nerves 5, 7, and 12, which is his, I'll have that hope this mess up. His articulation. Health assessment is awesome.
Health assessment is awesome.
Perfect. So those are intact. Let me fix my computer here. There we go. So next I am going to assess the range of motion for his neck. So I'm going to have you go forward and back, which is flexion and extension, side to side, lateral bending, and around. Rotation. Perfect. And so I'm going to check his trachea, which is midline. And now I'm going to feel for his thyroid gland. Swallow for me. Perfect. It's palpable, no masses, nodules noted there. Next, I am going to have you, well, first I'll inspect your back, the posterior thorax, looking for any lesions, deformities, masses. His skin looks good, no deformities or anything like that noted. Next, I am going to palpate. Do you feel any tenderness?
None.
No tenderness, good. And we're going to percuss. We hear resonant on percussion, which is normal. Next, I'm going to check for respiratory expansion. So I'm going to feel here at the 10th rib. Take a deep, big breath for me. Good. So his respiratory expansion is equal. No unilateral noted. Next, I'm going to place my hands on your back, and I'm going to say 99. So go right ahead.
99.
Again.
99. 99.
And this is checking for tactile firmitis. We're doing the same on the front side.
99. 99. 99.
Perfect. Next, I'm going to auscultate. Deep breath for me. Good. Good. His lungs sound clear throughout on all bases. We're going to do the same on this side. Good. Good. And I'm going to percuss the anterior thorax. Which we hear resonant as well, which is normal. Next, I am going to check for CVA tenderness. So let me know if you feel any tenderness when I palpate.
None. None.
All right, good. No CVA tenderness noted. Next, I am going to assess the different heart sounds, starting with the diaphragm of my stethoscope. So I'm going to check the aortic. You can just breathe normal. Pulmonic. Erb's point. Tricuspid. And mitral. And I'm going to do that same thing with the bell of my stethoscope. So that was aortic, now I'm on pulmonic. Erb's point again. Tricuspid. And mitral. Good. No murmurs or abnormalities noted. All right. So next, I'm going to have you go ahead and lie on your back. Might need another pillow because I'm going to check for jugular venous distension, and that you want your patient to be at about 30 degrees. So looking, there is no jugular venous distension noted, which is normal. That looks good. And again, I'm going to listen to the heart while he is laying down. Starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. While I still have my stethoscope on, I'm going to take a listen to his stomach. Taking a look at his stomach, I don't see any abnormalities, no deformities, no peristalsis, and no pulsations. Good. He has normal bowel sounds. And while I still have my stethoscope on, I'm going to take a listen to his carotid artery. Good. No bruits noted. All right. Next, I am going to percuss the abdomen. Good. There's dualness noted more over the liver, which now I'm going to check the liver span. Good. The liver is about 3 centimeters. Next, I'm going to start with light palpation. Let me know if you feel any tenderness. Any tenderness there?
None.
All right, so I'm going to do deep palpation. Good. And I did not feel the spleen or liver or any other organs, no masses noted, and all of that is good and normal. So you can sit back up. And now I'm going to start assessing your arms. So his hair is equally distributed, skin looks good, no lesions, deformities, everything looks good. So I'm going to check the range of motion of your shoulders first. So I'm going to have you go up, to the side, back down, in front, and then go one side over, and then do the other. Perfect. So he has full range of motion with his shoulders. We're going to check the range of motion with your elbows. So out and then in, flexion, hyperextension, and then like this and like this. Good. Full range of motion of his elbows and shoulders. Next, we're going to check the range of motion of your wrists. So you're going to go like this, in, to the side, and to the other side, which is radial and ulnar deviation. And then we're going to do the same thing with your fingers. So you're going to put them in and out, and then put your fingers all together. Perfect. I'm going to inspect and feel for any tenderness. Everything feel okay?
Awesome.
Good. And then I'm going to palpate for the epitrocular lymph node. Don't feel anything. Good. It's non-palpable, which is normal. Next, I'm going to check for your coordination. So I'm going to have you put your hand and go back and forth like this. Good. Same on with the other hand. Good. So his coordination is intact. And I'm going to also check your muscle strength. So I'm going to have you push against my hand. Good. And flip your hand, go the other way. Good. Perfect. We're going to check for light sensation. So you feel this okay?
Feel it?
What do you feel there?
Sharp.
Sharp?
Sharp.
Perfect. And I'm also going to check for your capillary refill, which is less than 3 seconds. That is normal. That is good. So next we're moving on to the legs. His legs, they look good. Hair well distributed. No lesions or deformities noted. I'm going to assess for pain. Any pain?
None.
Awesome. Any pain down here?
None.
Good. So no pain noted. That is good. I'm going to assess your pulses. Pedal pulse, post-tibial pulse, popliteal pulse. And then I'm actually going to have you lay back real quick. And the femoral pulse. And I'm also feeling for the inguinal nodes, which are non-palpable. They look good. And fixing the laptop again. Okay. So now I'm also going to feel for your radial. Those feel good as well. And the carotid. Good. Those are normal, no bounding, or weak pulse noted. Next, I'm going to check your reflexes, start with the leg. There you go. Good. And then we're going to check right here for the brachial. That's good. Good. And now I'm going to check for muscle strength. So I'm going to have you push against my hands. And the other way. Perfect. And then I'm going to have you put your feet, point them down and up and side to side. So he's full range of motion of his ankles. Now I'm going to have you stand up. We're going to check the range of motion of your hips. So put your leg in front of you and back. And to the side. And you're going to do the same thing with the other one. Good. Perfect. Now I'm going to assess his spine. I'm going to palpate it first. Any tenderness?
None.
Good. And bend forward for me. Perfect. His spine is nice and straight. No deformities noted. So come back up and bend backwards. We're checking the range of motion now. Good. And then go side to side. And then twist side to side. Good. So his full range of motion of his spine. Next, I'm going to assess his gait. So I'm going to have you start over here, and you're going to just walk straight. Good. Now walk with heel to toe. So like you're trying to walk in a straight line. Perfect. And then walk on your tippy toes the other way. Good. So now, I'm going to have you just stand facing forward and stay like that and keep your eyes closed. We're doing the Romberg test, making sure there's no swaying or anything, which there's not. So you're good. You can open your eyes now. The only other things I can think of to check, I'm going to check your grip strength, which is good, equal bilaterally. And then I'll check your capillary refill on your feet. So I'm just going to take your shoe off. Here you can. All right, perfect. It is less than 3 seconds. So that concludes our assessment.